The breast cancer program, I think, has really become an amazing program. Breast cancer these days is not just a surgeon seeing a patient deciding on treatment. Care is very, very individualized, and every patient gets different care these days to some degree. It used to be that everyone had more or less the same type of treatment for breast cancer, and that's not even close to being the case now. There is a lot of attention given to each individual's needs, and we have lots of choices, which sometimes makes it harder, but lots of choices in terms of how best to treat each patient. And the patients have a very important role in actually making a lot of these decisions for themselves once they learn the advantages and disadvantages to each of these options. We have representatives of all the major fields: surgeons, oncologists, radiation therapists, nurses, pathologists, radiologists, and we review each of our patients' care plans before they actually have their surgery and their treatment. And this is something pretty unusual. Most hospitals review these things after the surgery, after the treatment, and then try to figure out what might have gone wrong or what they could have done better. We actually do this before we take care of the patients, and we try to identify things that we can do better for each of these patients in a multidisciplinary fashion. And you get a much better understanding of the full nature of what has to be done for each patient. And instead of recognizing things you could have done better afterwards, we make it happen beforehand.